Suctioning. Okay, so when we say suctioning, it has something to do with the secretions, wherein this one is a mucus normally produced in the nose, mouth, and of course the trachea, which is the windpipe. So usually this is a clear or white secretion, and any change in color, amount, consistency, or smell of secretions indicates that patient is getting sick or there is something wrong with his system. So in this tabulation, we have here the different characteristics of the secretion, and the other column is the potential or the possible causes of having such kind of secretion. The first thing would be the thickened secretion, wherein it only means that there is no enough humidity and there is a dehydration. And another thing is the yellow or green, and there is also foul smelling and increased production, so meaning there is an infection. And what about the red streak or the bloody red streak or bloody? So meaning there is, aside from the infection, there is also no enough humidity, and there is a bleeding from gums, from infection or trauma like brushing, flossing teeth, and of course the nose. And rather is the frothy thing, which is there is a fluid build up in the lungs. And the brown secretion, it only means that there is an old blood, okay, and also an infection. So what do we mean by suctioning? So when we say suctioning, it is the removal of the excess secretions from the nasal cavity, which is the nose, the mouth, throat, and of course the trachea. And this is usually done with suction tip and of course the suction machine. And when do we perform the suctioning? Of course, when there is cough. If the cough is more frequent or sounds more congested than usual, then if there is also having trouble breathing or their breath sounds are harsh, and there is also a gurgling noise while the patient is breathing, and last one is if there is a suspected aspiration, okay, so whether it is a fluid or a liquid inhalation, so we need to do suctioning. Now we have different types of suctioning. We have the nasal suctioning, wherein of course we suction it from the nose, and of course the oral suctioning from the mouth, and nasopharyngeal and the oropharyngeal suction, which is suctioning from the nose to the pharynx is the nasopharyngeal, and the oropharynx, it's the from the oral to the pharynx, okay. And of course we have the deep suctioning, wherein we perform this one if the patient is having the tracheostomy tube or the patient is having an endotracheal tubing, which means the patient is intubated. So as you can see from this picture, if you will be performing the nasal suctioning, of course you will be just focusing on the nasal part. But if you will be doing the nasopharyngeal suctioning, of course you will be inserting the tubing from the nose up to the pharynx behind the throat. That one is the nasopharyngeal suctioning. But if you will be performing the oropharyngeal suctioning, that is from the mouth up to the pharynx. And of course the trachea, if the patient is having a tracheostomy tube, and if the patient is being intubated, of course you will be performing the suctioning. You will be inserting the suction tip from the tube down, of course here up to the middle, so that you can easily remove the secretion that is being trapped in the tubing. So what would be the equipments in performing the suctioning? Of course, we have the portable pulse oximeter. So what is the purpose of this one? So pulse oximeter is needed in checking, of course, the oxygen saturation of the patient. Okay. Then the drape, wherein you will place the drape, of course, with you will be placing the drape on the chest part of your patient, okay. Then of course the sterile gloves, since you will be handling secretions, you need to use also the sterile gloves, so that you cannot get any microorganisms that you will be tawag dito, that you will be creating another diseases for the patient. So might as well use the sterile gloves. Then of course you have the mask for your own protection as well. Then the gown, the face shield, the small container wherein you will rinse the suction tip. Then the suction catheter. For suctioning, of course, the nasal, you can also use the French tip 10 or French tip 12. Okay, then for the oral suctioning, you can use the French 16, and for the tubing, you can use the French 14. Then the connecting tubing. So what would be the purpose of the connecting tubing? So of course, if you will be using the suction machine, from the suction machine, you will connect, of course, the connecting tubing. And from the connecting tubing, that's the time that you will connect the suction tip. And that's the time that you can use the suction tip for suctioning the patient. Then another thing is the suction machine, the portable one. The irrigating solution, which will be used in cleansing, okay, in rinsing the suction tip, and of course the oxygen source. Knowing that we will be performing, of course, this procedure, the patient will be having difficulty of breathing actually, so you need to have the standby of oxygen. But if in case the patient is being intubated or having this kind of tracheostomy, much better if there would be an oxygen source, because after suctioning you need to connect again the patient and the oxygen source. Then face towel or wipes. After doing the procedure, you need to clean the patient's face. Now we have different types of suctioning. Of course, we have the nasal suctioning, wherein the catheter or small tip catheter is passed into the nostril. This is helpful when secretions are visible in the nose, or you suspect that secretions are blocking the nasal passage. So as you can see, even though the patient is very much awake, but then if she is not conscious enough, still she cannot expectorate the secretion, she cannot blow his nose, still the nurse has something to do with the suctioning of the patient. It is one of our responsibility. So what would be the procedure in doing the suctioning? Of course, you need to perform hand hygiene before and after the procedure. Then provide privacy as well with the patient, and do your self-introduction. So as a nurse, you will of course knock on the door of the patients, then introduce yourself. My name is Arlene. Good morning, ma'am. My name is Arlene. I'm your nurse for this shift, from this morning shift. I'll be performing suctioning for me to help you to blow your secretion or to expectorate your secretion. So I'll be putting some some kind of a tubing wherein I need to suction all those secretion from your mouth or either from your nose. Okay, then you need, of course, to check for the patient's identification. So how are we going to do that again? You need to ask the patient's name, the birth date, and of course you need to check for the ID band. If the patient is not conscious, of course you need to check for his ID band. And might as well, if there is a relative beside him, you can also ask the relative. Then check the oxygen saturation with the use of the pulse oximeter. If in case that the oxygen saturation of the patient is very much low, you need to pre-oxygenate the patient. Because if you will not pre-oxygenate the patient, lalo mo lang pahihirapan yung pasyente. Okay? So, mas maganda pre-oxygenate the patient para kahit paano hindi siya mahirapan before performing the suctioning. Then, wear gloves, of course, and mask. Then, you need to fill in the container with water. So, iti-test nyo muna yung suction tip para kahit paano malaman nyo pa rin if the suction machine is also performing well. Then, test the machine if it's functioning well by suctioning small amount from the container. Then, after that, you need to insert the catheter into the patient's nostril because we're here in the nasal suctioning. Then, apply suction, moving catheter around until all secretions have been cleared. So, for babies, we're using the bulb syringe. But then, if the baby is very much is too small, okay, minsan nga mas malaki pa yung bulb series kapag pinapasok mo sa mouth niya or kaya pag sinasuction mo yung nose niya. So mas preferred pa nilang gamitan mo siya ng suction tip, which is very much small naman, wherein you can use that one in suctioning the baby. Then do the same with the other nostril. Then turn off machine. Once done, then clean the patient's face. And after that, remove gloves and mask. Dispose it properly. So where are we going to dispose the gloves and the mask? Of course, you've handled the secretion, so you need to dispose that one into the yellow plastic container. Okay? And document the procedure. If the patient is very much awake, document how the patient tolerated the procedure. If not, if she's unconscious, check. Always check for the note for the amount, the consistency, color, and of course the odor of the secretions. Para if in case that you'll be handling the same patient, you have the comparison. Kung nag-i-improve ba talaga yung pasyente ninyo. Then we have the oral suctioning. As you can see from the picture, the nurse is using the hard plastic tip with a handle. This is what we call the yankuwer. Medyo malaki siya na matigas. Okay? So this one is specifically for oral. So useful when patient is unable to remove secretions by coughing or they are drooling because they cannot swallow. Nabubo. Okay? Nag-dudrool na siya loob ng bibig niya. Yung mga laway niya and even the secretion. Diyan na Kaya ginagamitan na natin ng oral suctioning. So same procedure as well with the nasal. Ang difference lang dito, syempre, you'll be performing the procedure on the oral. Okay? So you will be suctioning from into the patient's mouth, moving along the gum line. Okay? Then apply suction, moving catheter around the mouth until all secretions have been cleared. So if the patient has a face mask, I mean, you can also retain that one. Okay? You can place it here so that the patient can still use the oxygen while you're doing the suctioning. Then, if the patient has this cannula, nasal cannula, there's no need for you to remove the nasal cannula. Anyway, you can also perform the suctioning while she's having the nasal cannula. So same thing, clean the patient's face after the procedure. Then, the nasopharyngeal and oropharyngeal suctioning. Suction catheter is inserted to a predetermined depth through the nose. So as we've discussed before from the picture, nasopharyngeal or oropharyngeal. So meaning nose to the back of the throat is the nasopharyngeal, and from the mouth to the back of the throat is the oropharyngeal. So useful when secretions are pulled at the back of the throat. So kung kanina ang oral dito lang sa bibig, ngayon aabot ka na dito. Useful when secretions are pulled at the back of the throat and the patient is unable to cough. So same procedure pa rin. So the only different thing, the only thing that is very different is insert the catheter into the patient's mouth, moving along the gum line toward the pharynx. Okay? Then apply suction, moving catheter around the mouth until all secretions have been cleared. Then the last thing would be, again, remove the drape, help patients into Sims position to encourage drainage. Okay? Then do some oral care. Kasi nagtalsik-talsik na yan eh. So you'll be cleaning the face as well, and also might as well do also the oral care para malinis talaga yung pasyente. Then remove gloves, gown, face shield, and dispose properly. Then do your documentation. How the patient tolerated the procedure. Note the amount, consistency, color, and of course the odor of the secretions. Now moving on with the dip suctioning, or if the patient is having the tracheal or the endotracheal tubing. Okay, so this one is the removal of mucus from the airway, usually done with an artificial airway such as tracheostomy tube, and often done in urgent situations when secretions are unable to be removed by other methods and the patient is in distress. Natural, madi-distress talagang pasyente kapag wala siyang nakukuhang enough oxygen. Okay, lalo na kapag halimbawang naka-mechanical ventilator yan at ang mucus plug is nakatrap na dun sa ET tube ng pasyente. Tendency niyan, kapabayaan na yan ng mga nurses, bakit hindi sila nagsasuction? So, imbes na malalengthen mo pa yung buhay ng pasyente mo, eh lalo mong pinaiksi. Kasi hinayaan mo siya mag-plug doon, so hindi na siya naka-receive ng oxygen, enough oxygen. Then, this remove excess secretions to maintain patent airway using sterile technique, to also improve oxygenation and improve breathing, and to prevent infection. Kasi kapag di kayo nagsasuction, tapos yung character pa ng secretion niya hindi maganda, parang lalo mo lang dinadagdagan yung infection niya. And of course, the atelectasis. So, hindi na napapasukan ng maayos ng oxygen eh. So, there would be a collapse of lung tissue. Then, the purpose still is also to collect secretions for diagnostic testing. So another thing is there are certain like this one, the doctor before ordering antibiotics, they need to check first, okay, what kind of antibiotic that they will be giving to the patient. So in that case, papakuha pa siya ng mga sample from the patient bago siya mag-order ng any antibiotic na kailangan ibigay sa pasyente. So, same procedure. So, same equipments pa rin. So, we have the portable pulse oximeter, the drape, sterile gloves, mask and gown, face shield, this container, the suction tip. So, if you will be having this patient who is intubated, so you will be needing the suction tip French 14 for the ET tube, and the suction tip French 16 for the oral. Kasi kahit pa sabihin mo nakatubo lang ya, natural magdudrol pa rin yung mga secretion niya doon sa loob habang nakalagay yung tubo niya. You need to do suctioning as well for the oral. Okay? Then the connecting tube, suction machine, irrigating solution, the oxygen source, of course, with ambo bag, the face towel, and the wipes. Then what would be the procedure? So same procedure as well. Perform hand hygiene, provide privacy, self-introduction, patient identification, check oxygen saturation, drape the patient, position patient into Fowlers, wear gloves, mask, gown, and face shield if possible. Then you need to do the testing, connecting the tube to the suction machine, and test the machine if it's functioning well. Then, before performing the procedure, you need to pre-oxygenate the patient with 100% oxygen to prevent hypoxemia by hyperinflating with ambobag. Then, insert the catheter into the tracheostomy tube, of course, without applying suction muna. Then, saka mo siya i-advance until you feel the resistance. Kapag may nakararamdaman ka na mucus plug or secretion, that's the time that you will cover the whole of the suction tip, and that's the time that you will do the suctioning. Then apply intermittent suction while withdrawing the catheter, and limit suctioning time to 10 to 15 seconds. Then hyperoxygenate if needed. Then connect back to MEC vent or oxygen source. Then rinse the catheter with saline or sterile water to clear the secretions, and turn off machines once done. Then, clean the patient's face. Remove the drape, remove the gloves, gown, face shield, and dispose properly. Then, do your documentation. And note the amount, consistency, color, and odor of the secretions. So, magkakaparehas lang ng procedure. Kaya lang, knowing na different sites yung sinasuction ninyo, nagkakaroon lang ng konting different of materials na ginagamit. Okay? And of course, how will you perform? Kung kanina sa nasal, syempre sa nose. Pagdating sa oral, oral lang. Pag sinabi mong oropharynx, up to the pharynx. Oral to pharynx. Pag sinabi mong nasopharynx, from nasal up to the pharynx. Okay? So, if there is a trach and if the patient is intubated, of course, you will be doing suctioning up to the tubing of the patient. Okay? So, that's it for today. So, thank you very much for your time. Then, please do remember, do not suction too long. And the maximum suction time should only be 15 seconds. So, after suctioning, re-oxygenate the patient. So, I'll be posting a video of this oropharyngeal suctioning. Kasi yun yung medyo kahit papano magkaroon kayo ng idea on how to perform this actioning. Okay, so mas maganda yon. At least may idea kayo on how are you going to perform your return demonstration. So please be guided accordingly. I will post that one on your FB group. So thank you very much and hope to see you by next week.